Hello, everyone. Welcome to the Pathways to Family Wellness podcast. My name is Dr. Brendan Reardon, pediatric and family chiropractor.
And I'm Lauren McLean, a childbirth educator and the author of Learner-Led Homeschooling and Better Birth blog.
Well, today we've got a special show for you. We have a guest, Dr. Martin Rosen, who's going to be joining us to talk about common versus normal. There's going to be some emphasis as well on the CDC's new updated childhood milestone, the guidelines that they put out recently. We've been getting a lot of questions in the practice about that. So he's going to talk to us a little more about that and what that can mean in terms of things parents can look for and just overall ways to try to identify and keep their kids as healthy as possible. And so we're going to be speaking about that with Dr. Martin Rosen.
Dr. Rosen graduated Life Chiropractic College summa cum laude in 1981. And since then, he has built his career on the foundations of authenticity, mastering his chiropractic skills, sharing his years of clinical knowledge, and a commitment to excellence. Working together with his wife, Nancy Watson, DC, their practice has been a reputation for patient-centered care since its inception in 1982. As an offshoot of their practice success, the doctors have been teaching chiropractic technique, philosophy, and practice management for over 3 decades. Recently, they have created the Peak Potential Institute to further their commitment to teaching excellence in the art of delivering the chiropractic adjustment. Welcome.
Go ahead. Yes. Dr. Rosen, thanks so much for joining us. Appreciate it.
Oh, thank you for having me. I'm looking forward to this.
So yeah, we're really interested in getting more, kind of going in depth into common versus normal. I think, especially as a practitioner who works with kids quite a bit, a lot of times we'll hear parents come in and be like, oh, it's just normal, like normal constipation, normal,
right.
Not crawling, normal, not speaking normal, things like that. And we want to talk about some of the difference about common versus normal, right?
Sure. Yeah, I do. I want to, so I've been in practice 40 years, and over the decades, we see different issues that come up in the family practices. Like, for example, when I first started chiropractic, a lot of people would find out that chiropractors could help their kids with ear infections. So a lot of people brought their kids with ear infections. Then it was asthma. Then it became learning disabilities. Then it becomes digestive issues. Now the new things are tongue tie and head, flagellopathy, brachiocephaly, head shapes. So every kind of decade, things seem to shift. And the concern I have is that we start to factor all these aberrant patterns into normal just because they're happening a lot. And what chiropractic is always focused on, and what we would hope that healthcare, especially in the pediatric world, would be focused on is, why is this happening? Like, not accepting it. So, for example, when I got out of chiropractic school in 1981, the autism rate was 1 in 2,500. That was then. Now I think it's between 1 in 38, 1 in 42, wherever whatever stat you read. And the problem with that is we're just accepting it. We're just throwing the stat out like, oh, that's fine. So it's gone from 1 in 2,500 to 1 in 42. And in 10 years, it'll be 1 in 20. And then in 20 years, it'll be 1 out of every 2. And it's like, that's not normal, because common things are happening. We need to look at what's in our environment, what's happening with the birth process, what is happening with the medical professions, what is happening with our children, what are we giving them, what are we putting into them. So we need to really, it's a slippery slope when you take something that's common becoming normal. I was talking to a friend the other day and I said, we're accepting all these lower bars, and I'll talk about the CDC in a minute or two. We're accepting all these lower bars for our childhood development, and it's really scary to me seeing this happen. I said, if you watch the Olympics, would you expect if every 4 years you watch the Olympics and said, oh, world record, we're just dropping the world record now. Everybody's running slower, so that's fine. Everybody's not jumping as high or swimming as fast or, whatever it is, skiing slower. Would we accept that as a planet? We say, no, something's really wrong. Why are athletes deteriorating is how we look at it. And in my world, I see more kids with more complicated problems that are more accepted. Like people, and I'm sure you've had this in your practice too, Brandon, someone will come in, you do the case history, and they say, well, I have a little cancer, or I have a little diabetes. It's like, no, you don't have a little of something. It's a breakdown.
Of course.
And the same thing is happening with parents. They come in, bowel movements, simple thing like that. Oh, my pediatrician said it's okay. My kid's only having a bowel movement every 10 days. My first thought is, wow, if I was having one bowel movement every 10 days, I'd be really concerned. So that's my real fear about, taking things and making statistics about them, and then saying, oh, it happens to X amount of the population. So now this becomes a norm. And in the chiropractic profession, to us, normal is a body that functions normally, that manifests its optimal potential. We talk about potential. And when you're talking about your kid's potential, you don't want to basically cut those corners. So that's my concern around this. If Johnny has it and the person down the street has it, just because a lot of people have it or do it doesn't make it a normal activity.
Yeah, and I think that's such a good point with regard to looking at athletics as well. I hadn't thought of it that way, but that makes so much sense, right? It wouldn't be normal if we were like, 100 years ago, the world record was 10 seconds for the 100-yard dash, and now we're 20 seconds, and that's just fine.
Exactly.
Like, wait, something's happening, right? Something's not normal that's happening, and that would cue you on to look a little bit deeper to try to figure out what's really going on there. And it does look like, with regard to the new CDC milestones, it does look like the bar has been lowered in several areas, right?
Right. In a lot of areas, actually. I actually put together a chart at one point, so basically, when you're looking at milestones, developmental milestones, which is basically the ability of the kid to pick their head up, roll over, sit, crawl, stand, walk. Okay. Those are the basic milestones. And they are pre-programmed into our nervous system. It's not something we make up. There's an area in the base of our brainstem, the cerebellum and the brainstem, that these things are pre-programmed. They're supposed to fire off. They're supposed to fire off neurologically and then structurally. You wouldn't expect a kid to not be able to hold their head up and then to stand 10 months later.
Right.
So they're pre-programmed into our nervous system, both physiologically, structurally, anatomically, and neurologically. So all of a sudden the CDC says, let's change that. We're now going to change human dynamics. We're going to change, our birthright, and we're going to change what's been happening for years and years and years. Well, not years and years, hundreds of years in the human genome. So it concerns me that we're seeing lower. So COVID was a big example. A lot of developmental issues occurred during these 2 years because kids were shut down, whether it be because they stayed home, because parents had to keep them home, because they had to wear masks, they couldn't go to school, whatever it was, their social interaction stopped. And the way your brain develops is by input. So a lot of these kids were getting less input. So now all of a sudden they're getting less input, they're showing less function. And we're now going to accept that as normal. We're going to have a COVID generation. Is that what we're going to call them? We have Generation X, we have millenniums, we have my generation. And so we have to really be careful around it. So what the CDC did, one of the worst things that they did, or the most scary things, I should say, is they took creeping, crawling out of the milestones. And creeping and crawling is very important to develop integration in the brain, to cross-patting the brain, to have the right and left brain be able to talk to each other. It creates an area called the corpus callosum where the neurons talk to each other. So when you take out creeping and crawling, you take out neurological integration. And neurological integration is one of the things that causes all these developmental issues. If you can't integrate your brain, then you can't act in a normal environment. And depending on how you take that input is depending on your act. So if you take like the autism spectrum, it's now a huge spectrum. So depending on how the environment you adapt or cannot adapt to your environment, that's where you're placed on the spectrum. So if you skip developmental milestones, or you don't create them correctly enough, then what you do is you get a dysfunctional brain that can't coordinate and can't communicate externally and it can't communicate internally. And now, again, we start to accept that as normal. So some of the people in my practice who were most shocked about the CDC guidelines were pediatric nurses and speech pathologists and mothers. And the reason they were so concerned is because in a lot of cases, when we're looking at these milestones, especially things like language, motor skills, coordination, and processing, those four, what we're concerned about is that if in the first 18 months of life, we don't lay down a strong enough foundation, as the kids get older, they're going to have a more difficult time adapting to their environment. They're going to have more dis-ease processes, and they're going to have more integration processes. So what they're concerned about is as the CDC pushes these milestones out and makes it longer, when people get evaluated for early intervention, they're going to say to them, early intervention specialists are going to, if they accept these, going to say, no, your kid's fine, don't worry about it. Let's check them again at 2 months. Even the CDC said the first time your child should have a full neurological workup is at 18 months. That's their recommendation. The first time for developmental delays, 18 months. In our world, whether it be chiropractic or neurology, the brain develops almost 90% of its input and functionality in the first 2 years. And in the first year of life, your brain grows twice its size. And the cerebellum, which is where that brainstem area is that I talked about a while ago, grows 240%. So if you're not waiting till 18 months before you're even evaluating this, you've missed the boat. Yeah. You've already missed an opportunity where the brain is developing at its fastest rate. The way the brain communicates is making synapses. Nerves make synapses with each other. Those are basically the roadways that the brain uses to talk to the rest of the body. The highest peak of that developmental profile is at 8 months of age. Now, of course, it goes on our entire life. But so if we're waiting 18 months, 2 years and pushing these milestones out, we're missing an opportunity to create optimal functional potential, which is what we want for our children.
Absolutely.
And that's what scares me. So there are a bunch of, they did motor development, they did language development, they did social development, emotional development, all those milestones. They pushed pieces of them out. They didn't push them all out, but they put pieces of them all out.
Yep.
It would be kind of like the Olympic thing. It would be like, well, the 100-yard dash, we want to keep that up. You got to run under 10 seconds. But if you're running the 400, we're okay to let that drop. And that's what they kind of did to kids' brains. They said, okay, these areas are okay, but anything that's going to expand their potential, make their optimum functioning better, allow them to interact with their environment better, we're going to push those out so we don't have to worry about them. We're going to make them normal. And that personally scares me.
Yeah.
Because, we're going to lose. A lot of kids are going to fall through the cracks.
Well, and then at the same time, there's an expectation when kids get to a certain school age, they're going to be at a certain level. And so it seems like there's a bit of a disconnect there as well. It's like, okay, by the time kids are entering pre-K or kindergarten, they're expected to be at a particular level. But if the bar is lowered at one spot, like where's the makeup going to happen? So that's
that's the big thing. The whole idea of early intervention is that there's not a lot of money for that. And if you're in a school system, right? So if you're in a public school system and your kid has issues, you have two options. If your kid has issues, if they can bring someone in to help your kid with those issues, specialized training, that costs the school money, and they don't want to do it because most towns can't afford to do that. And if they don't want to do that, and you want to take your kid out to a private institution to do that, then the town loses that money too, because then they're not getting the other kid in. So they lose. So basically, it becomes an issue where the public school system is going to get hurt because they're not either going to be able to deal with these kids, they're not going to be able to support them, or the kid's going to leave the system and they're not going to get money for that. So it's basically a domino effect that's going to affect not only your family, the next family, but then it's going to affect the educational system because just like you said, they're going to have to adapt to kids who can't read in 5th grade, right? And they're going to have, so.
Well, yeah, and of the ones there, right? So the crawling one was the most shocking to me. Yeah, and it was interesting looking into that. I was reading a lot of different, speaking to different practitioners and reading different opinion pieces just to see and by and large, the pediatric PTs, OTs, chiropractors, speech pathologists, pediatric nurses were appalled. But then you'll get these supposed pediatric specialists in the medical world that were saying oh no, a child can be perfectly healthy without crawling. Right. And my first thought was they're not checking deep enough. Are they saying the child's perfectly healthy because the child's alive? Is that the metric? So I would just be really interested to see these people that are saying oh, the child's totally fine even though they're not crawling. I'm are they not checking for primitive reflexes? Are they not? There's probably other signs maybe a child could be okay that doesn't crawl, right? Maybe, but that would certainly be a pretty significant red flag, of more things to look for.
So, I was talking to somebody the other day. There was a chiropractor that I was talking to on another podcast, and he was saying basically what he was talking about is that if you do that and say that those kids are fine and normal, you're also lowering their bar for what your expectations are for them. But the thing that's worse about that is we're fault tolerant mechanisms, which basically means we compensate for things that happen to us. If you lose your right arm and you're right-handed, over time you can develop skills with your left arm. If you hurt your knee, whatever it is, you compensate. Well, if you take your brain and you take areas of your brain and weaken it, you will compensate. But the problem is, as you get older, you decrease your threshold for adaptability. So in other words, there's a certain amount of energy, neurological energy, life energy, whatever you want to call it, that your body delegates to just keep you alive, to maintain homeostasis, allow you walk, talk, keep your organs going. So let's say that's 25%. That leaves another high percentage, 75%, for other things, for optimum function, for whatever it is that you want to do, higher level brain functioning. But if you start to take compensatory patterns and cause the body to use more of that allotted amount for homeostasis because you've broken pieces of the body, basically the brain, then you start to pull away from that threshold. So when kids get diagnosed with most of these developmental issues, it's somewhere maybe around age 3 or 4. And the reason for that is at that point in time, when the prefrontal cortex, the front of the brain, is called in to work harder, if the the rest of the brain isn't working normally. It's not getting the right messages and it has to work harder. So the kids get a diagnosable condition. And the problem with missing something like creeping and crawling is that sets the stage for that part of the brain to work better. So if you skip that, your kid may be fine. But what that means is they're working twice as hard in school or in their environment to do the same thing that the kid next to them is doing. Right. So they may look fine, but you're right. So in some cases, people are not diving deep enough. And I think, well, does your kid still have primal reflexes, which should be gone by age 2? Because their fight or flight responses that are survival is supposed to be able to adapt after that. So a kid have primal reflexes. Does your kid have a more difficult time in certain environments? Like, let's say they can't be in an area where there's a lot of noise because they have to focus so hard because they're using so much more of their brain than they need to because it hasn't integrated that they can't be in an environment where there's a lot of loud noises, that it shuts them down or it makes them angry. And we start to look at how our kids react in different environments because the older they get, the more environments they're going to be put into. And as they start to get put into those more environments, those breakdowns that have been missed show up.
Yep.
And most healthcare practitioners, pediatric chiropractors do it. I'm sure some OTs and PTs will backtrack. A perfect example is I had this little girl who was brought into me. She was almost 2 years old at the time. And she just had digestive issues. She wasn't sleeping at night. She acted out violently. She would cry and scream inconsolably. And her parents brought her in and, we did an evaluation. And one of the things the mom said to me was that, her name was Bella. She said, Bella never creeped or crawled. She just went from sitting to walking. And so she had all these issues. So we started under care. And after about 6 weeks, as she was getting better, her mom came in and said, I can't believe this. I said, what? She had an older brother. And they went downstairs at a playroom in the basement. And she went downstairs and she said, Bella was creeping and crawling. And for about a month, instead of walking around the basement like her brother, she would creep and crawl. So she actually reprogrammed her system. And now she's about 13 years old. And she actually reversed all of her neurological stuff. She stopped acting out. She stayed on chiropractic care. Her symptoms got better. Like I said, she's 13 years old now and she's fine. But she actually reprogrammed her own nervous system innately when she was getting adjusted to start to creeping and crawling to reintegrate her brain. And luckily we caught it. She was only, like I said, just under 2 at the time. So she caught it in time where the brain was easily reprogrammed. Yep. So again, we have an innate driving mechanism that tells us what's right for us and what's normal. And if that innate mechanism gets interrupted, we will compensate for that. But the price for that compensation is something we pay later on down the road.
Yeah.
This all reminds me of breech presentation in pregnancy, which has sometimes been called the first developmental milestone.
Right.
The baby will turn vertex.
Right.
And, most OBs don't even look for it until like 36 weeks, which is too late to do a lot of things. Sure. Yeah. And so it reminds me of this looking earlier. Yeah, sure. Some babies do still turn by themselves, but you're getting lower and lower percentages who will. And so if we can do something to help the balance and whatever needs to be working better, that would be great.
That's actually brilliant, Lauren. I never thought of that as the first developmental milestone, but you're right. It's a neurological innate. It's born within our nervous system to be able to flip and exit the birth canal that way. But that's brilliant. And you're right. People don't look at it till much later on. Even in the chiropractic profession, we do a technique that it's called a pelvic constraint technique that helps to set up the pelvis so there's room for the baby to turn if there's something in the mother's pelvis that's inhibiting that process. But even in chiropractic, we're not taught to really look at that till later on because we're trying to give the baby a chance to do it by themselves when there's still plenty of room. But now that you mention it, I think I'm going to start looking earlier at my pregnant patients for those indicators because I usually don't do that till around 32, 34 weeks, depending on the pregnancy.
Yeah, I tell people at 32 weeks, that they should be looking into that. If the baby's not head down by 32 weeks, that's something to look at.
That's great. Yeah.
So the baby won't change. But the problem is that the way that OBs look at it is it's not a problem because they can just cut the baby out.
Exactly. Yeah.
So a breech isn't really, it's normal. It's a fine thing. And the truth is most breech babies are totally fine, but they don't think of it as something to look at because if the baby doesn't turn vertex, we'll just cut it out.
Well, it's scarier to think of breech normalization. They start to think of a C-section as a normal option.
Oh yeah, very much. Yeah.
That's like, oh, don't worry about it. Well, like you just said, don't worry about it. If your baby's not born by X day, we'll just, try Pitocin. If that doesn't work, you'll be in the hospital. We'll just cut you open and take the baby out.
Yeah.
That goes back to the common versus normal. It's like people, I have patients who, want to do a VBAC, vaginal birth after a C-section. And some of them get a lot of flack from the OBGYNs and they have to change OBGYNs because they're just not willing to try. Like, don't worry about it. You had a C-section last time. Your baby's fine. You were fine. We'll just do it again. And they miss the whole, number one, the whole neurology behind it. I can't imagine what it must be for a mother to, who's thinking of having a birth and having to go through a C-section. I mean, I'm sure there's trauma there. I mean, this is surgery when you're giving birth at the same time. I can't believe how hypersensitive you must be, that.
For sure.
I was actually a C-section baby when I was born and I'm fine. No. Except for this twitch, but I know it's not a video. No one else can see but no, seriously, you're right. It's the same thing. And Brandon was talking about too. It's like, we can't keep accepting lower bars. We don't do it with our own kids, right? I mean, you have kids, Brandon. I don't know. You have kids, Lauren?
Yes.
Yeah. And I have kids and we never accept, we always wanted to give them, and my parents, the same thing. We wanted to give our kids more opportunities than we had. We wanted to kind of raise them up. That's the whole ideology, is raising them up. So when you start to accept lower bars, I mean, I know my wife, for example, we homeschooled our kids for a long time. And my wife was very involved with a group called the Institute for the Achievement of Human Potential. And we worked with them for doing homeschooling, doing neurological development. And we taught our kids classes. And our goal was, we didn't homeschool them because we wanted to protect them. We homeschooled them because we felt at certain point in times that the educational system was failing them and we weren't willing to let that happen. So, and parents are like that. If you see a system that's failing your children, you want to pull them out of it and find a system that helps raise them up. So when when we change, when we talked about the school a couple of minutes ago with Brandon, when the schools start lowering the bar, then the parents don't have a place to put their kids that is a safe environment to help them create optimal potential. It becomes just a place where they're basically glorified babysitters because parents have to work and they can't afford to not go to work.
Yeah.
Yeah. Unfortunately, that's kind of the direction it's started to take.
Right. That's what we need to, that's part of the direction has to be. I mean, it's great if you have options out there, whether it be schools or, other facilities where you can send your kid that, not only to be nurtured, but that they will be able to express their potential and you can feel safe about it because, right, some people do have to both work. But if you create an environment where parents just have to accept the fact that that's the way it is, then you're right. Then personally, I think when you have to accept something that you can't change, then you have to go make a process inside yourself that accepts that. And if it's a lower bar, then basically you're going to fight to stay at that lower bar. You're not going to fight to raise it up because everybody around you is, in the same place. It makes it really difficult, which is why I think practitioners like us and people in the healthcare field have to rise up and say, no, this is no good. We have to set that standard.
Yep.
Yeah.
Well, go ahead, Lauren.
I was just going to add that, and speaking of schools and thinking about that, the sort of the path to getting to school and
Right.
those early developmental things for childhood, there's
Right.
also an issue with early identification of learning and autism and other issues that lots of counties will give free help to these babies and very young children.
Right.
But if we don't identify them until later, those families miss out on that whole
Oh, yeah. Yeah, that's,
opportunity,
yeah.
So like you can get someone to come to your house and give your baby speech therapy, for free.
Right.
But if we don't think about your baby's speech as an issue until you're past the age at which
Right.
that can happen, then you also miss out on all that. So there's also a little concern there with people being able to get the services they need.
Well, that's why I always, whenever I see something change that is not for the better, my brain goes, follow the money. Why are they doing some of this? And one of the things I know about for sure is that early intervention specialists are not only hard to come by, but they're hard to pay for. And like I said, if towns have to pay for them because then they identify kids. So most towns don't identify kids till they get into school, which is around 4 or 5 years of age. So when you identify kids there, like you said, you miss part of the bar. And when the CDC changes these guidelines, if you have an early intervention specialist come to your house, just like you said, at age 2, and your kid's not talking, it's not walking in a normal coordinated motion, and that bar is no longer there, they'll just say, no, your kid's fine. We'll be back in 6 months.
Right.
And that whole 6 months, you lose that whole window of opportunity. And my thought is, well, why are we doing this? Do we not have, the money to pay for this kind of stuff? I mean, I always wonder where that, where's the impetus to make a change like that? Who wins? Because it doesn't seem to me like anybody wins when you're starting to lower bars. I don't get it.
Yeah. The only thing I can think, sorry, Brendan, the only thing I can think is that they said they changed it generally from like 50 percentile to 75th percentile. So like, that whole idea that at this age, 75% of kids should be X, saying 5 words or whatever it is. Right. And so part of the thought, they say, is that when you get to that age, if your kid is not saying 5 words, then you do need to be worried, as opposed to before, like they'd be like, well, half kids do, half kids don't. And then those kids fell through the cracks because what do you think about that? Because it helps parents not worry unnecessarily. Like there's kind of a balance there that I'm struggling with a little.
Okay. So yeah, I did read something around that. And first of all, my first red flag is parents worrying unnecessarily. I think parents' jobs are to monitor, watch, and be concerned. Worry is always a bad word. It always has a negative connotation. Oh, you're worried. But be concerned is a different. It's being aware and being concerned. So if you have more than one kid, right, and so you have some experience with your other kids, and then you have another kid that comes along and is not following along those pathways, and you start to get an intuitive, parents have intuitive senses, especially mother, intuitive sense that something is missing, then I think that if there are practitioners out there that, what's the problem if a mother's concerned, calls up her pediatrician or calls up her chiropractor or calls up her, whatever it is, and says, look, Johnny's doing X, Y, and Z, can you check him out? If we lower that bar and say that it's okay, then what we're not doing is forcing healthcare practitioners to actually be able to identify those issues. So I have no problem if a mother comes into my office and says, wow, I think such and such is happening. Can you check them out? If I don't have that skill set to check them out, then I want to be able to refer to somebody else to check that kid out. And when you do it with the CDC, you're basically telling moms, just relax. Don't worry about it. And I think that's really wrong. And I think that's where it's really dangerous. So, yeah, there are, we live in the Metro West. It's a very high functional area. There's a lot of intellect here. So parents may have a very high bar, higher than maybe in another town or another area. But so what? There's nothing wrong with having that bar. It's like I had a woman, perfect example. I had a woman come in. She was visiting her parents in the town I live. She was from California. And her mom knew about me, and she had an 11-year-old who she was concerned about. So she brought her 11-year-old in. We did an evaluation. We found some pretty large discrepancies in where the kid's nervous system was functioning, developing. And when the mom came back in, I gave her what we do, a report of findings, told her what I found, and she started crying. And she goes, I knew it. I knew there was something wrong. I've been fighting for this for 10 years. I told this in the first year there was something. And she literally just broke down crying. She lived in California. No one listened to me. They told me, just relax. It's fine. She's okay. And her kid was great. The kid was, as Ren was, we talked about, kid was fine, except the kid was struggling in so many areas of life, and it was breaking the mother's heart. And literally, it took 10 years for someone to actually say, yeah, you're right. This is what's going on, and let's see what we can do about it. But again, it's that same thing. She went to all these people and said, oh, don't worry. Your kid's still in the decent percentile. Don't worry. And so that's a perfect example. And that happens at least several times a month in my office, where someone will bring a kid in and, they're usually over 3, and the mom knew something was wrong by the first 18 months, and no one would listen to her. And then when we evaluate it, we can actually, track, like, this is not happening. This is not happening. This is an issue. And, there'll be issues where the kid's having difficulty. So yeah, that scares me, the rationale that they use to basically tell parents to, just chill.
But I think the reason they do that is because they don't have any recourse. Whereas
Right. Well, that's right.
you have a different skill set.
Right.
Where
Well, that's what I'm saying. If they
can't do anything.
Yeah, but so if you keep the bar where it is and you hold that level of expectation, then the profession that's going to deal with your children, whether it be a chiropractor, a medical doctor, whatever you choose to use, then that profession has to be up to snuff around it. Then that profession, it's their job. It's not, it's like, so I've been in practice 40 years. I also teach a lot, as Brendan said. And what I love about being able to be in practice and teaching is that in both of those worlds, keep me in touch with what's changing. So when I work with kids, I'm talking about chiropractic students who, weren't even born when I opened up in practice, they bring new information to me that I can incorporate or I can choose not to, whatever, but it keeps me growing and it keeps my level of responsibility up. If I drop one of those, which I may at one point in time, I know that it's going to change the way I'm able to function and relay information because I'm going to lose a piece of what I do. And if you're in practice, I don't care if you've been in practice 40 years, 10 years, 20 years, and you're not keeping up with what your profession has to offer, whatever that point, then you're not doing the service. And so if you have an organization like the CDC saying this is okay, then you can just wave it off and say, good, I don't have to learn that. I don't have to know about that. I don't have to track that. I don't have to follow that. Like if you don't know to track a child's primal reflexes and know that at 15 years old, they shouldn't have startle reflexes in primal reflexes, then you're doing disservice to that kid. That kid's just sensitive. Just don't let him go out in crowds or, don't let him go to hear loud music. It's like you just keep limiting their lives. We don't want to limit people's lives. We want to expand their lives and their capacity to adapt. And again, that whole idea of the CDC and that whole percentage thing is about changing the percentage, decreasing the threshold, and lowering responsibility. And that's just not my thing.
And what we see as well is that parents, like especially the moms, intuitively know that something's, especially at a young age, right? You hit on that quite a few times, but we see this. Parents will bring their children into the practice, and they know that something's off. And if they're told over and over again that like, oh, it's nothing to worry about, that's also like overriding the mom's instinct, which is very dangerous, right? Like moms know. So as another example of like us like talking parents out of their intuitive knowing about what's going on with their children, and there's going to be a disconnect for the parents. They're going to sense like you had said, the example with the child that had been a decade of being shrugged off, and the mom intuitively knew that something wasn't right there. So it's like they're trying to talk her out of that, and also to hit on that a bit more, right? Like practitioners need to have the skill set to identify it. So if there's if I have no tools to be able to identify or work with what the specific issue is, then like it's easy to shrug it off and to be like, oh, well, it's normal in my book, like no problem. It's like, well, it's like if I see an x-ray and I don't even know how to interpret it and I see a whole bunch of bones and I'll be like, yep, all the bones are there. Looks good to me, but like without knowing like what anything would look like, then it's the abdication of responsibility, so it's
and that's kind of my point, that when you see a pediatrician, they don't know about the kind of things you guys know about, and they don't know how to look at that and how to fix it. That's not part of their training. And I've never heard of a pediatrician recommending you go see a chiropractor. I'm sure there are some, but
no, there are. There definitely are.
I hope there are, but I've never encountered it myself. But if they did, like a lot of these things could be taken care of.
Well, there's two levels. There's the parent practitioner interaction, and then you're right. So there's the pediatrician to, let's say, chiropractor interaction. So, an example of that is I had this pediatrician who used to refer kids to me with ear infections. And she would refer them pretty regularly. But at one time, another kid had come in she didn't refer, but had been a patient of hers and had bilateral ear infections for a long time. And she never referred the kid to me. And the kid ended up having tubes put in. So I decided, what the heck, I'm going to call her. I'm going to find out. So I called her and I said, Doc, I said, I really appreciate the referrals and it's great. And I do refer to her because she did some alternative work as well. I said, but I was curious why you refer, certain kids to me with ear infections and not others. And this is what she said to me. So she said, well, if kids have ear infections on one side and it keeps coming up on one side of their body, then I figure there must be something structural there. So I refer them to you. But if the ear infections switch ears or they're in both ears, and I don't refer to you because I don't think it's something structural. And I realized that at that moment in time, she had no idea what I do and why I did what I do. And, so I try, in my way, I tried to explain it to her. I didn't want to break the relationship because at least I was getting, a third of the kids that she was seeing with the ear infection. So you're right. The communication has to be open enough. But I think that communication is also based on the fact if I call a pediatrician and say, look, I just checked out, Johnny, and he still has a moral reflex and an atonic neck reflex, and the pediatrician doesn't really pay attention or care about that, then we don't have a place to talk. I said, he shouldn't be having a startle reflex at 2.5. I had a person who the mother came in, brought the kid in, had a whole host of symptoms and problems. And I did the evaluation. She came back in for the report of findings and she said, I want to bring my husband. I said, great, bring your husband in. He can come in. And so he ended up coming in by himself with the kid. And I found a reflex called a Babinski response. And the kid was I forgot exactly how old, but it should have been the Babinski and shot up to what's called clonus of the ankle, 2 neurological signs that there is some kind of lesion. So the father came in and he goes, I brought my kid to the pediatrician. He didn't find this. And I said, well, look, and I showed him the reflexes, and he was a physician. I said, well, what is your specialty? He says, I'm a neurosurgeon. I went, okay. But the bottom line was he said to me finally, he goes, look, I don't know really what you do, but I just saw what you said, and I saw your exam. He said, and I've been bringing my kids to my profession for the last 18 months, and no one has told me any of this or shown me any of this. He goes, so I'm going to let you take care of my kid. And so this is someone in the profession who they missed these reflexes that should be gone for this kid. And that, so again, it's all about the communication. It's all about what the standards are. And it's all about being able to communicate those standards. And as Brandon said several times, have somebody who knows how to evaluate those standards. And if you don't have someone who can do that, then you need to find someone who can do that.
Absolutely. And that's where I think you see where with the new guidelines that came out, right, there's a lot of appalled, like pediatric chiropractors, pediatric OTs, pediatric right, PTs, pediatric nurses, the ones who are actually like checking these things right, on a daily basis, like these reflexes to be like, wait a second, like right, the wheels fell off somewhere here and this isn't normal. Right.
Right. So, exactly. Yeah. So and again, so that's the issue with this kind of things. And again, I think as you mentioned, we've all mentioned so many times, you need to at least trust the parent. You can't just blow them off. Yeah, some parents get overly cautious or overly worried or whatever it is. But if you have a skill set to communicate with them and say, look, we checked your kid out. This is what we found. This is okay. This is not an abnormal, I had a family brought their kid in. Well, they were under care for a while. The kid wasn't walking. He was over 40. He was 14 and a half months old and he still wasn't walking right. And the mom was concerned. And I sat her down and I had taken care of the kid since he was 5 months old. I said, Michael's fine. I said, really, the only reason Michael's not walking is he has a huge head, which he really did, and he can't get his balance yet. Give it time. And then by about 15, almost 16 months, he started walking. He's fine. He's 7 years old now. He's doing fine. But it literally for him was completely biomechanics. The kid had a huge head and he just couldn't balance it. He didn't have his neck, even though he filled his milestones, it took him a while before he could actually balance all the way. And by, like I said, by just under 16 months, he was walking, which was still in the normal time frames, 11 to 17 months, and neurologically. But I was checking him throughout the whole time, neurologically, to make sure that things were okay, that the mom just wasn't, being crazy about it. But so you have to have that skill set.
Yeah, the only reason you were able to rule that out is because you had everything, all the boxes had already been checked. Like
exactly.
You had enough boxes to check off, to know that okay, everything else checks out fine. He's just got a giant head. It's an anatomical thing. Right. This will correct itself, right? And then
I also felt very sorry for the mom too, given the size of that head. But,
I can imagine.
I was taking care of her too, though.
I like that you were able to tell her why.
Right.
Like you were able to say, this looks good, this is fine, this is all normal. He's likely not walking because of the size of his head. Okay, thank you.
Exactly. Yeah, I think that's, your job as a practitioner is not to fix everything, but to at least be able to go within your bandwidth and be able to follow that bandwidth. And if it's something outside your bandwidth, then be able, to tell somebody, refer somebody else. I do that. We all do that. If you have a kid or an adult that's tracking, and so I'm not a PT, right? So if I have a patient who comes in with a shoulder issue and I make the adjustments and I find that everything structurally is okay and there's nothing underlying it, but they need some rehabilitation, that's not my practice. I don't do that. So if they want to do it, I'll refer them to somebody to help them rehabilitate once the underlying structure is there. It's the same thing with kids. If we have their nervous system functioning as best as we can, but it needs to be rebuilt, then I will send them to an OT or a PT or somebody I know that does programs to help reprogram the nervous system once we get the underlying pathways cleared out.
Yes.
If concussions are a perfect example of that, kids get concussions all the time. And mostly the medical model is, when your head stops hurting and you're not dizzy, go back out and play again. And our paradigm is, no, we need to fix the damage that the concussion caused because we don't want to lower the threshold. If you send a kid back out after having one concussion without any treatment, they have a higher propensity for the next one and a lower threshold. So you need to be able to treat within your bandwidth. And then once you've followed your bandwidth and your patterns, if there's something that needs to be done, have somebody that you can refer out to or to do the work that needs to be done to rehabilitate. It's just as simple as that.
Perfect. And I think that's such a good example you made many times about the threshold, right? It's like the body's having in these compensatory patterns and loses optimal function because of the resources being allocated to other places instead of to optimal function, right? So
exactly.
Yeah. Awesome. Well, is there anything else you want to share? I mean, we covered a lot of ground, got some great information here. We really appreciate everything you shared with us. So I know this has been a great learning experience for me. I'm sure it was for Lauren as well.
If I could do a little promo, I'd like to do that just because my wife, Nancy, Dr. Nancy, and I wrote a book during the COVID shutdown things. We wrote a book called It's All in the Head. And it's a book for parents. I mean, chiropractors too, but it's a book for parents to go over just what we talked about. Talked about common versus normal, talked about primal reflexes, talked about milestones, talked about craniofacial distortions and what they mean. And again, so what things parents can look for, both milestones, structurally, functionally. And again, the book is called It's All in the Head. You can get it on the website. It's allintheheadbook.com. You can also order it from Amazon. So yeah, that would be, if you're interested in what we said and want to learn more, you can also find it on our websites that Lauren just mentioned, drmartinrosen.com. And again, if you want to contact us, we're open to fielding your questions, answering questions. And we also have a referral list of chiropractors, and Brandon and his wife, Amanda, are two. They're amazing chiropractors for pediatric chiropractors in areas if you're looking across the country and in other countries also. So check us out.
That's great. Yeah. And just as an additional plug as well, we've got several of those books in our practice, and parents have found that to be a very valuable resource, that It's All in the Head. So it's a really interesting read, and it's a great resource. So highly recommend that one. Awesome. Well, thanks so much, Dr. Rosen. I really appreciate you taking the time to share with us today.
Well, thank you guys for having me. It was great. I appreciate it. And what you guys are doing is amazing. So keep it up.
Thank you.
All right. Take care.
Take care.
Hi, everyone. Dr. Brennan here again. If you've enjoyed this podcast, I encourage you to check out the award-winning magazine, Pathways to Family Wellness, which was the inspiration for this podcast. The magazine addresses all aspects of family health, including holistic perspectives on physical, emotional, and social well-being. You can start by browsing hundreds of articles at pathwaystofamilywellness.org. Also, if you're looking to find a family chiropractor, ICPA Docs provides specialized care for infants, children, and pregnant women. Visit the Find a Chiropractor directory at discoverkidshealth.com. I look forward to tuning in with you again soon, and remember to share, rate, and review, as this can make a big difference in helping this information reach more people. Take care. The Pathways to Family Wellness podcast is produced on behalf of the ICPA, the International Chiropractic Pediatric Association, as well as Pathways to Family Wellness.